Bryan Kobel, of course, literally one of my favorite guests on the program, who Greg likes to call Kobel because Brian's saying it wrong. Bryan Kobel, CEO of TC BioPharm Holdings, stock symbol TCBP, the future of cancer and infectious disease treatment. This is a company that's using fundamental business practice to grow the business as well as science. And of course, raising money, dealing with stock market, biopharma segment and everything else that has seen some challenges the last couple of years, but Brian's bringing them through it. And it's always a pleasure to have him on the air with us because good things are happening there. Brian, good to talk to you, man. How are you?
Hey, good to see you guys. It's been a while, and I'm excited to see you in person in 2 weeks.
I hear you're coming into town, and guess where we're going?
Where?
Hot Corner.
Oh.
Mike?
Are you really?
Mike, what's Hot Corner?
Hot Corner are the beautiful seats at Petco Park right behind third base. You get to see the field, and you get to see the opposing dugout.
I can't wait to see
cool.
Jackson Merrill, man. That was awesome.
Just because I want to do this so Brian can see this,
Yeah.
while he's on the air, I'm going to email the video.
Oh, awesome.
Because I'm taking him to the Padre game, and his cohort,
Okay.
and you. We're going to go to the game, and we're going to sit there in Hot Corner. I know it makes you cry, but I want him to see what this looks like.
Brian, are you what baseball team do you follow?
I'm a Yankees fan, so I followed you guys when Soto was there because I was trying to recruit him just, with my mind.
Yeah, you mean Soto that was unproductive here, but goes over now the All-Star game in the All-Stars for the Yankees?
Shocker.
What the hell was that? I can talk sports with you all day, Brian. Hey, can you talk about what's going on with TC BioPharm Holdings? Obviously, we've got a lot of happy people. We got people asking questions because they want to know where you're going next. You guys are the people that kind of explained why allogenic gamma deltas are promising broadly across the world, but also you're making hay with acquisitions, you're making hay with capital formation, you're making hay with science. Talk about the whole thing again for us, would you?
Yeah, we're fighting the good fight. There's a ton of publications out there in Nature and papers that have talked about for a while now that if you look at the outcomes of cancer patients, the ones that have the highest populations of gamma deltas tend to have the highest response rate and have the most success. So as an organization, what we're doing is we're taking healthy donor cells, isolating these gamma delta T cells, which are immune responders and your first responders, expanding them to the hundreds of millions, and then giving them to cancer patients to improve the outcomes. We have our ongoing ACHIEVE trial, which has been dosing patients actively over the last 2 months. We'll update everybody on that shortly. Things are going well for us there. We expect to have some data readouts coming very shortly there. We expect to launch our US trial as well in the near term. And to your point, we have some acquisitions in the hopper in the gamma delta space and in the CAR space, where we think we can superpower these gamma deltas even further to drive solid tumor responses. And we're looking at infectious diseases now, things like monkeypox.
You talk about monkeypox. It brings us back to the days of 2020 where we first heard about COVID. You guys are ahead of the game there on that thing. Any pushback from FDA, any pushback from your scientists saying, nah, this is not a thing, like we sort of heard about COVID in the very beginning and ended up people were wrong about it? What are you hearing about that just overall on the monkeypox front?
I mean, it's definitely a thing, right? It's actually been going on longer than people are aware, especially in the regions that it's in Africa, which are difficult, right? They're austere regions, poorest countries, and those countries tend to not move the needle, unfortunately, for organizations and big pharma. So, somebody else has to do the dirty work. And we're happy to be that group. And we've always thought that viral infections are a great spot for gamma deltas because inherently that's what they're doing every day anyway. The reason you're not getting the flu every day is because your gamma deltas are fighting it off, right? So it's the same premise. Can we overload the system with these great, highly active, aggressive killers and protectors of the immune system in the body to fight off these infections? And we think we're in a good spot for that. We're looking for a clean room right now, and we're looking forward to testing it out and seeing if we can help people out in Africa and other parts of the world.
Brian, talk about the U.S.-Europe connection with your company, because I know you spent part of the world, part of the time in Scotland, and part of the time over here. Talk about that a little bit. What's going on over there?
Yeah, so we've got our manufacturing facility in Scotland, along with our R&D group there. They've been making a ton of headway actually over the last, call it 60 days. We announced a while back that our process development team had brought ourselves forward in our process now off of a leukopak, which is the donor blood. We can create 8 times the product for 87% less the cost. So an extremely big.
Is that a key selling proposition? Even cost? You never think about cost in biopharma, but I guess it's a business like anything else, right? I mean, it's so funny. I never thought about the fact that cost is actually is actually a benefit for you guys, and that's kind of a big story there.
It's a huge story. In fact, and this is not to throw rocks at anybody, but if you look at some of the struggles you've seen with Bluebird, that's one of the big issues, right? That their sickle cell product is so expensive. They took a big loan from Hercules. They didn't get nearly the uptake they thought they were going to take commercially. And you're seeing that across the board, that there is a big shift in the consumer side of the business where people aren't, and insurance companies aren't covering these extremely costly treatments. So from our perspective, it does a lot of things, but it certainly lowers the cost for us. And that's a big hurdle in cell and gene therapy in general. Right now, one of the biggest question marks for pharma and companies that are acquiring businesses like ours is, what's the cost of production? What's the cost to manufacture this thing, right? And how do you do it at scale? So our ability to do that and start driving change right there is a massive step for us. And Lauren Bohr and her team have done an incredible job in that. So really excited to see where that turns out. We should have an update on that in Q4. And
can't wait to see it. Can't wait to see it here week after next too, bud. It's going to be good.
You know, I was a Gamma Delta at San Diego State.
Were you really?
Yeah, my wife was an Omega Mu.
I'm surprised you went to college.
Mike was an I felt the thigh.
That too.
Thank you, bud. Bryan Kobel,
Big
of course,
stuff.
CEO of TC BioPharm